Boom, boom, boom. Hey guys, how's it going? Dr. Dan here. Long time no join. Canafam, it's always great to have a little talk, get some stuff off my chest, let you know what's going on in the medical cannabis world. I have a really, really important topic today, folks, that I want to delve into. I think it's very, very appropriate given the current state of things. Opioid related deaths and its correlation, negative correlation, as we'll see, with increasing dispensary counts at the county level. So I wanted to delve into this one because there was some really good peer-reviewed literature behind this. You'll check it out. I left a link in the description, folks. If you look below, you'll see a little link to the British Medical Journal article. It was published this year. So recent peer-reviewed journal, British Medical Journal, highly renowned, all right, quite credible. So it was a 2021 article published earlier this year, titled, let me just make sure and get this right, Association Between County Level Cannabis Dispensary Counts and Opioid-Related Deaths in the United States. And I'll, just to give you guys a little backdrop as to why this is so important, as you know, I'm sure many of you know, since 1999, opioid-related deaths have just increased sharply. If you look at that period from 99 going all the way up to 2018, which is when they sort of gathered data for this particular study. It was for 2014 to 2018. If you look at 2018, 2/3 of all overdose-related deaths were opioid deaths. All right, 2/3. It's a lot. Okay, that's 67%. If you look at it in numbers, 46,802 deaths in the United States in 2018 from opioids alone. All right. So no small number, make no mistake, absolutely an epidemic, and we're absolutely still in it. So what this landmark study did was they looked at dispensary counts on the county level, and related these to the number of opiate deaths, age-adjusted opioid-related deaths at the county level. So when you micronize things like that, you're able to get more of a local flavor of what's happening locally. And what they did was they extrapolated these local county-wide results over a much larger area. They looked at 23 states, okay, that have either a medical or recreational or both medical, recreational or medical cannabis program, okay? So really what they did, they found this negative correlation, right? And I'll explain what that means, but basically the higher storefront dispensary count that you have, and they looked at medical and recreational, okay? The higher the number of storefront cannabis dispensary counts that you have will result in a decrease in opiate-related overdose death. This is very important to look at. When you go from, the real big thing that they found was when you go from one storefront dispensary to two in a county, all right, you decrease the overall opiate-related death by 17%, all right? More importantly, when you look at fentanyl, and I want to focus on this fentanyl portion here. I'll get into fentanyl and its analogs, okay? When you increase the storefront dispensaries from 1 to 2, you decrease the fentanyl. This is a synthetic analog of morphine, of opiates. It's about 100 times more powerful than morphine, about 50 times more powerful than heroin. For the fentanyl, you decrease, when you go from 1 to 2 dispensaries, you decrease the fentanyl deaths by 21%. Okay, no small piece. So looking at these numbers collectively, this is monumental. It's a public health concern. Okay, we're dealing with death here. All right, we're dealing with opiate-related death. We're dealing with overdose death. And we've seen it right here in real time in a very short time period where there's been a lot of legislative change with medical cannabis allowance, legalization, recreationalization of cannabis. We're seeing this in a very short period of time that we've been able to put a dent, quite a significant dent, in the opiate-related deaths, particularly the synthetic opiates, the non-methadone synthetics like fentanyl and the fentanyl analogs. All right. The T40.4 class of opiate analogs. T40.4, it's a way of referring to fentanyl and the synthetic non-methadone fentanyl analogs. All right. The cousins of fentanyl. All right. Furthermore, what this BMJ article found was that when you increase the county level dispensary count from 2 to 3, you decrease the total opiate death, all right, an additional 8.5%. All right. So you go from the 17 to 25% reduction in opiate death when you're going from 1 to 2 to 3 dispensaries countywide. All right. This is hugely important, folks, because when we look at things from an epidemiologic standpoint, and we're dealing with things regarding death and how we can avert death and the kinds of options that we're affording patients, we see very clearly, it's very transparent when you look at their statistical analysis that they went through to come to these conclusions. Really the key step here when you look at things from a legislative standpoint is the allowance of the legal sale of dispensary cannabis in these states. All right. Not to get too granular, but this is an important thing that I want to make very transparent to people watching. It's not just the allowance of medicinal cannabis alone as a legislative move, because that allowing for medicinal cannabis alone specifically does not allow for the sale of cannabis, all right, by a dispensary. So there's the individual user that's legally protected versus a dispensary that's legally protected and can make a legal sale of medicinal cannabis or recreational if a state gets to that point. All right. And that's really just what I wanted to drive home today, folks. Just so you could get an idea of some of the logic behind having a medical cannabis program. And we're just starting to scratch the surface in terms of being able to realize the public health potential that it could afford us if we just keep our mind's eye on what's important, and keeping our eye on legislation, and keeping our county commissioners and people involved in legislation at the county level, cluing them into information like this. So it'll open up the door over time, just as information spreads. This is new information right here. All right. It's just published in 2021. I encourage you folks, if you like this video, hit the like button, subscribe to my channel, share this video if you think this is applicable in our current environment. I think it does shed some very important light, and it really provides a lot of promise for the future in terms of county level ordinance and the allowance of dispensaries, and really allowing more access, just widening the access for patients to be able to get alternative medications, because a lot of people are trying to use marijuana effectively, I might add, in terms of addressing their pain complaints, without the addictive and fatal potential of opiates. There's a huge downside to opiates. There is upside to having opiates as an option. But when you look at things like the explosion of fentanyl and the synthetic non-methadone fentanyl analogs, that's really where you've seen the explosion of the street-related overdose deaths. Okay, that's where you've seen the biggest impact in the deaths, and where you see the biggest decline in those fentanyl-related deaths is where you have the increase in dispensaries. So this is real logical, not a whole lot of rocket science to this, people. If it was rocket science, I wouldn't be talking about it. I stay in my lane. I just want to highlight what really what the science is telling us, and what's being shown, what we're finding in the peer-reviewed journals. That's really what I consider currency in this ball game when we're looking at public health, wellness, affording options, and the alternatives that we should afford ourselves when we're thinking about public health, and how we go about shaping our policy with the information that we have at hand. So I encourage you folks to check it out for yourself. the inquiring explorational mind, really will come to their own conclusions. So I invite you to look at it for yourself. I left a link right there in the description to the BMJ article. Check it out. It's really, really important. I encourage you folks to share this, because I think this is really an applicable, just a good study of what happens when we set our minds to taking a good look at the information that we have here, and galvanizing that, and taking it and putting it to good use, and shaping public policy from that. Listen, guys, I think I'm out of time. I'm still rolling, seeing patients. It's always great joining you. I get a whole lot of satisfaction from being able to share a lot of this good, useful cannabis information with you guys. If you're curious to hear about certain specific topics, feel free, drop me a line, folks. I'm always happy to hear from you. Apart from that, have a safe and happy day, and you folks be well. All right, Dr. Dan out.